Hi, everyone. Welcome. We're going to get started in just a minute, but while we're waiting on a few more folks to join, we have a poll question for you. That is, what sugary drinks or healthy drinks efforts are you working on right now? And we'll go ahead and get started in a second. Awesome. For those of you who are just filing in, we've got a quick poll up here. If you could answer that for us as we get started. Hi, everyone. My name is Yui Iwase, and I'm with the Voices for Healthy Kids team. I'm going to get us started off for our virtual advocacy training series with a welcome and some housekeeping. All right, so this meeting is being recorded, and the recording will be emailed to participants with any slides or any other materials within a week. We will be taking questions in the chat today, so feel free to put questions in the chat to everyone or chat me privately, and I am tech support if you want to find me on the chat. And we will try to address all questions before the training concludes. If you need any technical support for the meeting today, please chat me at technical support from the pull down menu in the chat. And then we ask that in the large session, all attendees mute their microphones unless called upon to participate. Being on camera is optional today. We do have closed captioning available during this meeting. You can turn on that service in the menu bar. The recording will also be sent with captions. And we very much value your feedback. So we're going to be sending out a follow-up email with some resources recording as well as a survey. If you could respond to that, would be great. And we ask that all participants have respect and allow grace for one another today. Please experience this training how you learn best and let me know if there's anything I need to know. So in that case, I will close the poll and share the results and pass it on to Rena.
Hi, everybody. Just give me 1 second. All right. Hi. Hi, so I am Rena Singh. I'm the Director of Campaign Planning and Communications here at Voices. Thanks for joining us this afternoon. Thanks for filling out the poll. Looks like we have a great mix of issues. A lot of folks working on sugary drink tax, healthy kids meals, water access, and some folks not at this time, but I'm sure you've had experience, or hopefully this will help you as you think about what's next for you. So thank you so much for being here today. So as we said, we're going to talk about, give me 1 second, sorry, computer, there we go. We are going to talk about some sugary drink research that Voices has just concluded. Today I will walk you through just a little bit of background and methodology behind the research, and then we're really going to focus on kind of what did we learn generally from the research? What were some themes and findings? What were some of the questions that came up from folks? And what does that mean as we think about our messaging strategies? What are some insights and tips that we can share with all of you? And our research focused on sugary drinks as well as sugary drink taxes. So we'll talk a little bit about both. And then we are thrilled to have the wonderful Stuart Burlow from the American Heart Association in DC join us. Stuart and his partners in DC are doing incredible work and have been doing incredible work around sugary drinks, and he'll talk about those campaigns and the Nutrition Equity Act and everything that is going on there now. So let's jump in. So as I said, our research took place between June and December of last year. It just really finished up at the very end of last year. It started with qualitative research with online discussion groups that tested awareness, values, and attitudes, and then messages around sugary drinks and sugary drink taxes. We then wrapped up with a quantitative survey in December of 1,600 voters with an oversample of Black and Latino voters. Our online discussion groups included, we did some online discussion groups with conservative men, non-college educated women, African-American moms, Latina moms, and a group of older African-Americans and Latinos. We are looking to get a little grandparent mix in there, and our online discussion groups took place in a handful of states across the country that gave us political diversity and geographic diversity. So let me dive into the themes and general findings from the research. We learned a lot, and I'm going to share some of those findings with you from both the quantitative survey and the qualitative online discussion groups. And so you'll hear me kind of reference both as I go back and forth, and just let me know if you have any questions. So the first thing that emerged from our research is really that we need to keep doing some education about how much sugar is in drinks and really what is a sugary drink. There was consensus in our findings that soda and fruit flavored drinks are sugary drinks, but beyond that, there is a lot of different thoughts about what counts as a sugary drink. In our focus groups, we heard a lot of surprise about the amount of sugar in lemonade. So I think, folks kind of chalked it up there as knowing that it had sugar in it, but not really realizing how much. So there were a lot of surprised moms, and I feel like I can say that as a mom too. So kind of surprised us, I think, some of the things that a lot of us often keep in the refrigerator. We found that Black voters were significantly less likely to put Gatorade and other sports drinks in the sugary drink category. And so I think it just means we need to do some more talking about this, and I think get people to think more broadly than just soda. As the research tells us, sales of sports drinks, energy drinks, bottled coffees and teas, and sweetened waters have been rising over the past decade. And so as we're talking about that, I think we just need to make sure we're encompassing all of that. And so one of the ways that we're thinking about doing at Voices is looking at infographics and how do we do it visually. And we know those of you that have done campaigns have had some really creative ideas about how you can also do that in person with bags of sugar and things like that. So here's a sample infographic that we have, but we'll be continuing to look at this and see if there's things that we can help create to get out to folks that might be useful. We also talked to folks about the perceived barriers that may affect healthy food and drink choices. And so 3 of those came up. They were access, choice, and cost. When it came to access, survey respondents agreed that it's important for people to have access to healthy food and beverages beyond just having enough food. But generally, few saw lack of availability or accessibility as the main reason that someone may not make healthy food and drink choices. When it then came to choice, it was our white and Latino survey respondents that were more likely to think a person's health is determined by the decisions they make. Conservatives also tended to fall into this area of kind of what they called individual choice, which I don't think is probably very surprising. And then when it came to cost was really what people saw as the main barrier to choosing healthy food and drinks. It came up in our qualitative research and our online discussion groups that Black and Latino focus group participants noted that drinks like soda tended to be cheaper than bottled water or other healthy drinks in stores, and that neighborhood stores often promoted cheaper drinks like soda over bottled water. We also talked to folks a little bit about marketing. We think there's a lot of room here to continue to elevate the idea of how much money big soda puts into marketing, how that marketing is targeted, how it is focusing our children, what that looks like now that we are also dealing with social media, also thinking about how kids have been home more this year and what that means. And really thinking about that impact also, as we know, the marketing that focuses on the Black and Hispanic community as well as Black and Hispanic kids, and really elevating that issue. Respondents were somewhat concerned about marketing at kids. They were more concerned about marketing at kids generally than marketing at large. We didn't really see, I think, the strong reaction to marketing that we thought we would. I think we definitely need to do some more work there. And dig a little bit more in that, but we think it's a supporting message. But right now, I don't think, at least based on our research, we wouldn't necessarily say like lead with this right when you want to drive into it, but it can be part of the case we make about like taxes and why we need to reduce sugary drink consumption and the role of big soda industry. I wanted to just pause there for a minute and have people share in the chat box, and just for folks that are working on this, or have worked on it in the past, any tips or suggestions on how you've talked about marketing that has resonated in your work? Has there anything that you've done that's really gleaned a strong response from folks, or how you've used that in your organizing or communication strategies? I'll give folks a minute to put that in the chat box, and then we'll come back to that. So the next few things that I'm going to talk about pertain directly to sugary drink taxes. Um, our initial reaction to the idea of a sugary drink tax was mixed in our survey and in our focus groups. And the main point of contention was really who decides. And again, that's probably not super surprising. We had 2/3 of our survey respondents say it was a personal choice, and the other third believed that there was some role for government to play when it came to this, given the public health implications. White survey respondents generally said it was not the government's responsibility. And within this, the 2/3, you have to remember, I think this is where also some of our folks, some of the voters that are least likely to move on the tax issue are, right? They're on this personal choice side. They generally tend to think of a tax as government overreach. They tend to be more conservative and from rural and medium-sized towns. And so in some places, in some of that grouping, we have some room where we can do some wiggling and some pushback, and we might be able to move folks, and some folks in that group we're just not going to move. I'm going to pause and just go to the chat for a minute. It looks like we have a couple suggestions on our marketing, talking to teens about how they are used by the beverage industry. They don't like it. I think that's a great point. I think how we're thinking about engaging young people is really important, and that's something that we would love to hear more from people on. Printing off the amount of sugar packets on each soda freaks people out when they see 60 packets on a Mountain Dew. Absolutely. Yes, that is terrifying. I think of my brother in his teenage days and all his Mountain Dew. Teaching 6th graders about marketing methods that are used on them. Interesting. Education that shows the comparison of the daily intake and the typical beverage sugar content. That's great. I want to encourage folks throughout this to use the chat to share that. I think one of the greatest things about hopping on these calls and working with everybody is sharing our ideas and strategies with one another, because let's not recreate the wheel. Let's hear what everybody's done and what's worked well. So thank you for sharing. So another question that emerged when we talked about taxes is a tax on sugary drinks unfair, which again, we have all heard in our work. This came particularly from the younger voters in the survey, so 18 to 29-year-olds and Black and Latino voters. There was concern that a tax would disproportionately harm communities of color and those with low income. And there is some room here. I'll talk about it in a minute. We were able to talk to some folks about this issue. And I'll get to that in a minute about how we can shift folks in this group to maybe see taxes as a little bit more favorably. The other question that emerged when we talked about sugary drink taxes was, will it work? So this was really I kind of call them our mushy middle. These were folks in the middle that just weren't quite sure about the tax. They maybe didn't really have a super strong feeling one way or another, but their real concern was would something like this even work? And how has this worked in other places? And what do folks do with the money? And, kind of gotta show me that it's going to make a difference. And so also we can talk about that in a minute. We did also learn, even with all of that, that we can build support when it comes to a tax. After hearing a series of messages in our survey, informed support for a tax increased, and more so among voters of color. And so let me talk a little bit about some of the messaging insights and tips that helped with that. And hopefully some of these insights can help you again with your messaging strategy as you think about going forward. So first, again, just repeating what I said at the beginning, this ongoing education. I think some of the examples that we saw in the chat as well, talking about how much sugar kids are consuming. We know it's a problem. How much sugar of that is coming from sugary drinks? Really trying to think about how to convey that message in a way that resonates with people. Here we use the example of Gummy Bears. So kids consume as much as 140 teaspoons of added sugars from sugary drinks per week, which is 280 Gummy Bears. So I think if you think about 280 Gummy Bears, that feels like a lot and kind of makes your stomach hurt. And there are actually 280 Gummy Bears in that pile. And so again, this is on our website. Folks are free to use it. Please do. The other piece is talking about long-term health outcomes tied to sugary drinks. So this was the most persuasive message that made people want to do something about reducing sugary drink consumption, and that included a tax. And in our messaging, we talk specifically about type 2 diabetes, heart disease, and tooth decay. And so we really need to bring this message home to folks. It was a unifying message. It worked across respondents. People responded well to it. And so really, I think we're all doing that, but I think just continuing to get that out there and really thinking about what that means for people's long-term health and well-being. So then when it came to the tax, people were more supportive when we discussed that the tax revenue would go back into the community for specific programs. And we also discussed that it went back to communities hardest hit by the health outcomes tied to sugary drinks. So this helped with voters of color in our survey. And it also helped with folks that were concerned about the taxes. We saw the issue of the tax being unfair and disproportionately harming communities of color or folks with low income. So this message helped some of those folks that were struggling a little bit about what they thought about it. And actually some of our focus group participants told us that this is actually what changed their mind from the beginning of the conversation to the end of the conversation. And this is a little gift that we have that talks about what your community could fund with tax revenue. Again, it's on our website. Feel free to use it. Of course, folks that are working on campaigns, you'll want to drive home the message of what your plans are to use the money for after you've talked and worked with the community about what is needed. But here's obviously some ideas or a general piece that folks could use. So we also found that we want to talk about the evidence. We want to talk about how taxes have worked elsewhere. And then if we think a little bit about the mushy middle that I talked about earlier, is this actually going to work? We need to show folks the evidence. And so here's some examples, right, of where we have seen taxes work and what they have paid for. And so this helps make our case. Again, it helps with folks in the middle. It helps with people that are still persuadable. When you tie the evidence message plus the revenue going back into the community message, we were actually able to move people on tax to be supportive of a tax. The persuadable people really needed to hear both. In our messaging resource that just came out, we actually have some proof points from different places that you can use. These are just a sample. They're not comprehensive, but feel free to use them. Again, pull from success stories that we have on our sites, pull from successes that have been written up about, from your colleagues in the newspaper from other places. But this did help because I think people were wondering kind of, how do you really implement this? And then what do folks really do with the revenue and what's the impact of this revenue? And I think, even thinking about COVID, we have seen the impact of some of that revenue, right? In Seattle, we think about the grocery vouchers, and that's an incredible story to share now too. And then we realized we really need to start with an aspirational message, right? So here we have every child deserves to grow up healthy. In this case, we were talking about which means providing healthier options like water and milk. We want to start here when we're thinking about our messages, start with something aspirational that's looking at a vision that we want to create in the world, especially for us, we work on kids. So when it comes to kids, this was a top testing message for us in our survey when we were testing messages on sugary drink taxes. It was also received positive feedback in our focus groups. So as I wrap up, we're going to do one more poll. If I can, Yui is amazing. One more poll. If you have, and it doesn't have to be about tax, I think it could be generally what you're working on. What kind of messages have you had the most success with? Have you used an evidence-based messages, health outcomes, impact? So in this case, we're talking about funding, but maybe other impact in your work or educational messages. And which ones have been the most success? So let's just take a quick poll and see where people are. And while people are filling that out, and we'll come back to those findings in 1 second, I just want to highlight, we have, again, as I've mentioned, this new messaging resource. I think Annie dropped a link in the chat. We have a new suite of infographics in our toolkit on our website, which has a bunch of the ones that I just featured. Please feel free to take those and use those as you need them. We are doing ongoing message research, so we'll have more information coming out from this batch of research soon. We're also looking to do, we are in the middle of conducting more research specifically with the Latino community to test our messages and see what works and what doesn't on a deeper level. And we're hoping to have some initial findings from that soon. As I said earlier, I encourage all of you to talk to one another. I just think talking to our colleagues is some of the best resources we can get, which is why we have Stuart on today. And feel free to contact me or anybody at Voices if we can be helpful. So let's see, on the type of messages, health outcomes is in the lead, along with and then educational messages, and then impact, and then evidence about what has worked elsewhere. So thanks, folks, for sharing. I am going to hand it over to Stuart, and if you give us just 1 second for a little technology, we're going to swap screens. Give us 1 second, please.
Hey, Rena, as you're doing
Yeah.
that, we had one question come in early on as you started and asking about if Gatorade Zero considered a sugary drink, or if that, those artificially sweetened beverages came up in your conversations at all.
If Gatorade Zero specifically came up?
Yeah, or maybe even artificially sweetened beverages as well.
I would have to look. We gave folks a list. I'm sure Stuart can talk about that and what they're talking about in DC, and I'm sure my science-based friends can answer that. But in our list, the list we gave people was like 5 things. I think we just said Gatorade generally. But let me go back and look while Stuart's talking. And I think if other folks can weigh in or have suggestions also from a science and research background on what's included, that feel free to drop that in the chat.
And sorry, a few more questions are coming in as we get going, but what message would you recommend using when you have decision makers asking about the evidence that supports reduced health outcomes?
Yeah,
they always ask, what is the proof you have on reducing obesity, et cetera?
Yeah, I think that is ongoing as we're still studying. Again, I would ask other people to jump in if they have experience as we're still studying. I think I believe there are international studies that we can point to. I think, I do think one of the biggest things is also thinking about is using data, right? So how do we look at, the other thing is not only the results, but using data as making the case as well, especially as we think about the vast change in data or health disparities as we're looking neighborhood to neighborhood and tying it all together into a story and using that on the front end. But I think also continuing to look at the results from the other places that have done it and continuing to look at evaluation. I know like Philly's coming up on 5 years. I think in 2022, we're going to have a bunch of the cities are going to be at 5 years. So I think we'll probably have a lot more information coming out. But I also think in the short term, looking at where the funding's been used and painting that picture. And I just think in our research, we found the examples from Philly and Seattle actually resonated really well with folks. And so I think thinking about some of that, but I would, again, I'll have other folks should feel free to share, or, Stuart, if you want to take some of that too, and kind of how you're talking about it in DC, because you're in real time here. So you can talk about what's working right now.
Sure. Well, so do you have my screen up?
I can see it, yeah.
Okay, perfect. Well, yeah, thank you. Yeah, so I can definitely touch on some of those questions as well. Probably, I think they'll probably naturally weave in, hopefully, in some of what we're talking about. So really excited to share with some of you the work that we've been doing around sugary drink tax here in the District of Columbia. Just to kind of level set, make sure everyone's on the same page as we start. So we've probably been working on sugary drink tax for about 3, maybe 4 years behind the scenes. And then our public campaign really began just about 2 years ago in the summer of 2019. Our first version of our bill was introduced in October of 2019 in the DC Council. And then our current bill was just introduced about a month ago on March 29th. And we're really excited that our first public hearing on the bill will be in the Human Services Committee 2 weeks from today on May 19th. So we are, yeah, as Arena said, we are in the middle of this right now, and we're really excited about the way things are going. So Together for DC Health, so this is our coalition. And really what I want to emphasize kind of, and really, again, just kind of take a step back too, really what I'm going to focus on is kind of the themes of our campaign, how we looked at our messaging, not so much talk about any of the legislative strategy or things like that. So Together for DC Health is really intended to emphasize what our campaign is all about. That this is truly a community-driven, community-led campaign. This is not an AHA campaign, it's not a CSPI campaign or any other big group. This is residents of wards 7 and 8 and 5 in DC, residents of the most under-resourced and underserved communities in the district, in some cases, really in the whole country, coming together to say, we are sick and tired of being targeted by industry. We're sick and tired of having a lack of grocery stores and access to healthy food and drink. So this is what this is all about. It truly is a community collaborative effort together for DC Health. You see, it's not talking about a sugary drink tax, it's DC Health. And the images in there, the font and the colors are really supposed to be, to really have a look and feel of a lot of those neighborhoods in wards 7 and 8. So it's not the typical DC skyline of the National Mall and things like that. These are the neighborhoods that those of us who live here, this is our DC. So Don't Be My Health was sort of the first version of our coalition and movement. And this is still a huge part of what we're doing. So for those of you, obviously most of you not being from here, Don't Mute My Health is a play off a hugely viral grassroots movement, an anti-gentrification movement that started in DC. I think it was in the summer of 2018. And this just dominated our community for a year or so. Gentrification has been a big issue for a long time here. And one particular event just set everything in motion, and Don't Mute DC became this huge movement. So Don't Mute My Health, when the campaign started in 2019, two just amazing advocates from wards 5 and ward 8, Ronnie Webb and Stuart Anderson, formed Don't Mute My Health. So again, this is really talking about all the things I was just talking about with Together for DC Health. Don't Mute My Health came about as saying, again, we're tired of industry targeting. We're tired of the lack of access we have. We're tired of the fact that wards 7 and 8, which have 150,000 people, only have 3 grocery stores, but there are like 15 grocery stores in ward 3 with only 75,000 people. So again, it's Don't Mute My Health. We want change. We want to reverse all of the inequities around nutrition that have existed for far too long here in Washington, D.C. And that's really what Don't Mute My Health was intended to convey. This logo, as some of you have seen in other presentations, we put that on a t-shirt, or not we, Don't Mute My Health put that on a t-shirt. And in the summer of 2019, those things were just insane. And people wanted these. We couldn't print them fast enough. Who would have thought that, that logo, broccoli and Don't Mute My Health would become this huge movement, but it became this like status symbol. Everybody wanted a Don't Mute My Health t-shirt in wards 7 and 8 and 5. It was just incredible. And this has really continued. The Don't Mute My Health movement is a really integral component of this community-driven effort as we move forward with our legislation. So these on this slide, these are a couple infographics and one-pagers. Also, these are from, I think, late 2019, so ones we were using in the first version of the bill. And again, these probably don't look like your typical AHA documents, because they're not. These aren't AHA or Voices documents. These are coalition documents. So that's again, I think, as you can tell, what I'm really trying to get across is our campaign truly is community-led and community-driven. So sure, a lot of the data on here maybe came from AHA and Voices. We helped identify the right sources and kind of thinking through what some of those messages should be. But these both were designed by a local graphic designer in Ward 8. So the community most targeted by industry and most impacted by sugar beverages being Ward 8 in Southeast DC. He knows that better than anyone, and he designed, kind of took AHA maybe documents or Voices documents to see the information we had, but completely revamped it to make it look and feel like something and sound like something. This is the way that this will resonate in those communities. This is how we will talk to our neighbors. This is how we'll communicate, and this is what is necessary. And I just want to also point out that the AHA logo on the screen, that's on my slide. That's not on these documents. So I think that's another really important piece of this, is that so far, and I think as we continue, You haven't seen any AHA logos on any of this, and you won't, except for one example. And that's absolutely intentional, because this is truly a community, as I said, I'll say it again a million times, sorry, it's a community-driven, community-led campaign focused on reversing all of these inequities that have existed. And AHA is a part of the campaign and the coalition, but it's certainly not our coalition or campaign. So again, to that theme of really authentic voices, that I think has been something that I think we're most proud of in our campaign, is again, that we have had the opportunity to really help elevate and bring forward real people who live in these communities that are most impacted by sugary beverages, that have the least access to healthy food and beverages. So these we call quote cards. Voices has done an awesome job of putting these together for us. Probably at this point, we probably have about 15 or 20 of these, and we circulate them through on social media. And again, these are real people. These aren't, people who sit around our table, our coalition meetings, whatever else. These are people in the communities, that work with some of our organizers. And, as we've kind of sent these out, as we sent examples to our organizers, all I said to them was, hey, all we need is a photo and a quote of why people are behind this movement around nutrition equity. I didn't tell them what to say. We didn't give them talking points. We didn't give them any tips or pointers, anything. We just said, we want a quote of why they care about this issue, why it's important to them. And this is what we came back with. So again, we probably have like 15 of these that are all totally different because they're in the real voice of real people explaining why they care about nutrition equity. And again, another thing too, as you've seen as I've kind of gone through this, you haven't really heard me talking about sugary drink taxes. I'm talking about nutrition equity. And again, that's the name of our bill. There's of course, very good reason that our bill sponsor came up with that name. And I'm not going to go into all the details of the bill for time, but again, that is the focus of our campaign, is nutrition equity, promoting, creating nutrition equity, and reversing all of these inequities that have existed here for so long here in DC. So again, this is similarly, I think another really important piece of this is giving community members the opportunity to talk to one another, to learn from one another. As kind of Rita was saying in these forums, as we're all kind of learning from one another and hearing different stories. These are not presentations where like this, where someone is kind of talking, going through slides and doing Q&A. These are truly facilitated dialogues led by some of our organizers who are just fantastic leaders in their communities. You can see the one on the left was just occurred this past weekend. The one on the bottom in green, that's an example. That was at the beginning of the pandemic. So, think back to April of last year when, everybody was at that point still kind of freaked out and everyone was staying at home and not doing anything. These were a really good opportunity for people to come together and talk about, healthy recipes or managing stress or all sorts of things that relate to kind of this theme of Together for DC Health. And we did those kind of throughout sort of the first half of the pandemic when people really were staying at home all the time. And again, these were open dialogues, conversations. And again, we weren't talking about the tax. We weren't trying to pressure people into supporting a sugary drink tax. We were talking about just, again, these broader themes around nutrition equity. What kind of programs need to be funded? Why aren't they funded? What do we need to do? That kind of thing. So certainly media advocacy is a huge component of our campaign, like every campaign. The image on the left, it's not entirely done, but it's about 95% there. This is an ad that we're going to be running actually tomorrow in the Washington Informer. And that is a really important African-American focused newspaper here in Washington, DC. And, the woman on there, many of you have probably seen speak, just an absolute dynamo, Dr. Yolanda Hancock, who is our superstar of our campaign. We love her. She's just incredible, so passionate about this. And so this is an ad that will run both in the print newspaper, in the digital version, in their e-newsletters. An email blast actually just went out a few minutes ago, and on social media. Aside from kind of explaining why she supports the bill, there's a call to action as well. And ignore the call to action, we're fixing that up so it's not just a bunch of jumbled letters. But so we're doing ads like that, again, in African-American focused media. And then on the right is a screenshot from some media coverage. This was also back in 2019. But again, kind of going back to the theme I keep coming back to, the headline, as you can see, is why a new campaign is pushing for healthier lives in DC. So it's not saying why a campaign is pushing for a sugary drink tax or whatever else. It's healthier lives in DC. And that might sound simple and broad and basic, but that is, we'll say it again, that is just what our campaign is all about. It is truly about promoting nutrition equity in communities of the District of Columbia that currently do not have that. And yes, we talk about the tax, and I probably could have put up plenty of screenshots of media coverage talking about the tax, but everything we pitch and everything that we focus on is talking about just this, healthier lives in DC. So these are two kind of draft images, so you can kind of ignore them right now. These are in progress, but these are for the current version of our campaign. The one on the right, I'm sorry, the one on the left, kind of Rita was kind of alluding to this broadly, is, this lays out some of those bubbles are, here's what the problems are. Here's where, DC really lacks nutrition equity. And then some of the other bubbles are, here's exactly what this bill is going to fund. So coming back to some of what we heard in our community dialogue, what's funded in the bill, all sorts of programs and grants and investments in nutrition equity are what came out of these community dialogues. And I think that's really important to note as well. And so this is really laying out, you might be opposed to a sugar drink tax, but the investments are going right back into the community, and here's specifically what they are. And kind of lays out those exact programs that will be funded. And then on the right, again, you can kind of ignore the design because we're still working on this. Voices is doing just an amazing job putting these together for us. But these are going to be looking at, we know you're hearing all this misinformation from the beverage industry. They're scaring you. They're saying this is going to cause jobs and raise prices and all these things. Here's the myths, here's why what they're saying is not true. And here's the facts. And sort of as Rita was saying, we're using a lot of examples of showing this did not happen in Philadelphia. This did not happen in the Bay Area. All this doom and gloom did not happen. That industry is trying to say is going to happen here in DC. And again, similarly as I described before, although Voices is helping to create these for us, you do not see an HA logo on there, a Voices logo. These are going to be our coalition's materials. And again, exposing industry tactics, again, a really important piece of this. The day our first bill was introduced in October of 2019, the American Beverage Association created the Alliance for an Affordable DC. But the only issue they seem to care about of affordability is sugary drinks. They don't seem to care about affordable housing or anything else. And this is, again, are some infographics that we had created to help explain to the general public that, when people are coming to your door and talking to you, or leaving a door hanger on your front door, and they say they're the Alliance for the Affordable DC, they're really big soda. It's just the American Beverage Association. So don't believe what they're telling you. They don't care about small business. They care about protecting their profits. So that's sort of a quick, or hopefully a quick run through of our messaging, some of the materials we've created for our campaign. Excuse me. But just some quick takeaways. Things, again, I've said 1,000 times already, so really don't need to say it again. But as you can tell, how important it is for us to truly let the community lead. It's not just something that we say in our coalition. The community truly does lead. It's not HA pulling some strings in the background. This is community led. As you saw with our quote cards and some other things, we value so much authentic voices, real people telling real stories here in DC, in the real DC, not kind of the one that everyone sees on TV, is so important. And trust. I mean, some of our coalition partners I've worked with for years and years, some are new in this effort, but we talk a lot about some of the research that Rena was going through, and I make sure I always put all this amazing research that we have from HA and Voices and others in front of our coalition. But if our community leaders are saying, this messaging will not work, this is not the way we phrase things, or this is not the type of message that's going to work in my neighborhood, then we say, then scrap it, don't use it. Use what works, as long as we're still focusing on the science. maybe I'm not supposed to say this, but I'm a huge believer that AHA can and often should be in the background. It's okay. We are a hugely active part of this coalition, but we're just part of it, as I've said before. And the leaders are the community. It's not AHA, it's not CSPI or whoever else. We've created these opportunities for dialogue, for real, true, authentic dialogue, not something that claims to be a community dialogue, but it's really just people talking at you, real dialogue, that will continue on as we move through this. We're not afraid to call it industry when we need to, sometimes indirectly, sometimes directly. And again, at the end of the day, it's all about just listening to the people most affected by this, impacted by these policies, never telling what we want to do, but really reflecting what our community wants us to do. So I will stop there. Happy to answer any questions. And I think most of you probably know how to get a hold of me. So thank you so much. Appreciate it.
Thanks, Stuart. We had a few questions come in, and one is, have you received any pushback from calling out Big Soda?
No, I mean, I think that we've done it when we've kind of done it the way I explained it. So fortunately, we have some partners who on their own can and do say what they want to say. I mean, Dr. Hancock, who I showed earlier, she today spoke at the Pepsi annual shareholders meeting and was brutal. I shared with some of you on this call her presentation, and she's as blunt as can be. So people like Dr. Hancock can maybe say things that AHA wouldn't, and say it in a different way. So yeah, we haven't gotten that pushback, but I think also we know how to message that. We've worked with some of the lobbyists that represent industry here in our area for so long on tobacco issues and sugary drink issues. So we kind of know their playbook. And so we know what to say, what not to say, what landmines not to fall into. So we've been careful in how we push back on industry. And sometimes we just kind of ignore it because frankly, their reach on social media isn't all that great and it's just not worth getting into the fight. So yeah, we haven't gotten any pushback from doing that, but we've been very careful and I think smart about how we've done it.
Great, thanks, Stuart. Another question that came in is, how did you find community members to connect to?
Yeah, so as I said, in the coalition, there's a few folks that I've worked with forever on a bunch of different issues, and some are new. And so many of the community leaders are folks that have worked with some of our coalition partners on different issues. And without going into the whole backstory, the way I've been working behind the scenes, as I mentioned, for a couple of years with a council member who wanted to do this, and we just never felt the time was right. And then in the summer of 2019, as the council was working on the budget, there was a proposal I think it was by the mayor, to cut out a whole bunch of nutrition funding, primarily school nutrition funding and some other healthy food access programs in the district. There was about $3 million of funding in these communities that we've been talking about. And one of our bill sponsors proposed a sales tax on soda as a way to generate that $3 million. But she did that knowing that the plan, this was just short term, and then we were going to go ahead and do the excise tax. So that was a way that we brought in actually a huge part of this coalition, was that we said, you guys might not be crazy about a sugary drink tax, but it's a way to save these really important nutrition programs. Some of them were SAP programs at farmers markets, some were against school nutrition, things like that. So being able to save these really critical programs that huge, big coalitions cared about was really a good way. That was the way we brought people in initially. And then people, I think, really understood that this tax wasn't regressive in the way that it was being described, that it wasn't going to do all these horrible things that industry would tell you. So I think in that soft way that people were brought in through a very small sales tax, that allowed us to really expand the coalition as we went full steam ahead on an excise tax.
Great, thank you so much, Stuart. We appreciate it. And as Rena is pulling up our final slides, we just want to promote our part 2 to our virtual series that is happening next week on May 12th, which is a deep dive into the messaging research that we had an overview of today. And we will be following up with recording and the slides within the week, and included in that email will be a short evaluation that we asked everyone here to complete. So thank you so much, everyone, for joining, and I hope you have a great rest of your day.